Every day, medical researchers look for new ways to improve our lives. From chronic disorders to occasional aches and pains, modern techniques and medicines can enhance the quality of daily activities. And when it comes to emotion-induced ailments, knowledge in preventing future encounters of discomfort can make all the difference. Here's an example.
I basically would have to concentrate very hard on keeping myself stable. All things that most people, I don't think, have to deal with in life. And boats, my father used to love to take us fishing. And after the first time experiencing my seasickness, we never went again.
Even car rides or any kind of amusement things couldn't be done because of what he would experience. So it did interrupt as far as a lot of things that couples, when they first meet, go out and do. We weren't able to do that.
I mean, you should enjoy going out and enjoying life and doing things and experiencing trips and car rides and planes and things like that.
Ralph Altero is not alone. Just about anyone can experience motion sickness if exposed to sufficient movement. However, some people are more susceptible than others and become uncomfortable with hardly any movement at all.
Motion sickness is caused by the conflict of the object being seen, sight of the object being seen in a horizontal or vertical position, and the inner ear transmitting the message to the brain in a different format. So the conflict is between the eye and the ear. Why one is more sensitive, as in the case of Mr. Altero, we don't know.
For those planning to travel and who may experience a mild case of motion sickness, over-the-counter medication can help provide comfort. But for those who suffer from moderate to severe symptoms, a prescription-strength medicine may be beneficial.
What sets the over-the-counter medications separate from the prescription medications is that the over-the-counter drugs contain antihistamines, while the prescription medication contains scopolamine. NASA sponsored a clinical study several years ago to identify the most effective motion sickness drug to protect their astronauts. And they tested different agents in volunteers who were placed in spinning chairs, and they identified scopolamine as the most protective medication. Now, scopolamine is available by prescription in low-dose tablets and also in a topical patch form.
The topical patch delivers only a fixed dose of medication, so what may be prescribed for a petite woman may not be enough for a large man. Oral alternatives, such as Scopace tablets, can be prescribed according to the patient's needs and are typically taken 1 hour before travel, providing up to 8 hours of comfort.
I believe that there had to be some help out there. And there was, and he can live a normal life now that we never at one point thought he could have. You know, especially driving or going on a boat, you know, even just going and commuting to work was difficult for him at times.
Yes, and it's amazing how when you kind of accept that you can't do things, how the world just gets so small on you, and then all of a sudden when you get help, how all of a sudden the world opens up to you.
The response of patients such as Mr. Altero has been so positive, so that if you feel that you are a candidate for such medication, please consult your physician.
Whether sailing the seas or driving the open road, the discomfort induced by motion sickness can ruin the simplest of plans. And for those who often find themselves concerned about experiencing these symptoms, preventative action can help to ensure comfortable travel.
Side effects may include dry mouth, blurred vision, drowsiness, disorientation, and confusion. Patients should avoid drinking alcohol, should not drive, operate machinery, or engage in other activities requiring alertness.
For more information on treating motion sickness with Scopace, you can log on to www.motionsickness.net. As with any medical condition, it's always best to consult your physician for recommendations on treatment. Thanks for watching.